folks, very good afternoon and welcome to our Insta Live today. I, Dr. Divya Sharma, take immense pleasure in welcoming you all to this live session where we are going to talk about my favorite treatment these days, Endymed IFine, right? So, till the time people are joining in, why do I talk about jawline tightening, eye skin tightening? And it's more for millennials, you know, the 90s, 90s and 80s, late 80s born people. You know, as we age chronologically, the moment we cross that threshold of 30 years, your skin starts undergoing changes. And as all the poets say, your eyes are the mirror of your soul. Eyes are also a mirror of your intrinsic aging. And we all age more or first around this area compared to the other areas of the body. So what happens when we age? So technically, patient, you might start noticing few early crow's feet or wrinkles. So when we say crow's feet, I mean those lines that extend from the corner of your eyes to your temples, and you may feel that my under eye area started looking little hollow, or patient may feel that my under eye looks sunken, or you know, people say that you're looking very tired and you don't look fresh. So this is the time that we should start doing something about it. Now, what all things can we do? You know, over my last couple of reels, I've been talking about dark circles. So dark circle is like a generic term. It's like how we tell every cough, cold as allergy. So dark circle is a brand generic term. What do we really mean? What are the causes of dark circles? So when you talk of dark circles, it could be pigmentary changes, that actually you have pigment in the under eye area, or you are an allergic patient, so you have darker under eyes. But today we are talking about the subtle changes of aging that have started and how do we start managing. So what happens when we age? The upper layer, so compare your skin to a 3-floor house. The upper layers of the skin is known as epidermis. It starts thinning. So you might start seeing a little blood vessels in this area. The middle floor is the dermis, where you have these collagen fibers. Their crisscross strength gives us the tightness. And as we age, it starts slacking. So you might start noticing a couple of, these jowls or smile lines and early aging and a little bit of sagging. And of course, with age, we get fat all over the body, but on the face, your fat starts descending. So you might start feeling that my under eye area started looking much more hollow than it was looking, say, 5 years ago. So what to do? Of course, your dermatologist, we prescribe a lot of creams containing retinoids, peptides and vitamin C's. But then I need to do something about tightening your collagen, the crisscross network. And the best time to start a non-invasive procedure that we're going to talk about is probably your early 30s. It can be done even more. Why particularly? Endymed is my favorite. I'm a believer of non-invasive, more so that there is, very less downtime, there's no pain. So what do we exactly use? Now we are going to use radio frequency. You must have heard about lasers, they are optical energies. Radio frequency is heat energy. So we convert electrical energy into heat energy, and that heat is going to work on your collagen, making it stronger, and also delays the degradation of your collagen, which happens with age. So it is non-invasive. When I say non-invasive, I mean we are not poking needles, or we are not, injecting an artificial or a cross-linked filler or something. So this is more of a preventive treatment, and for very early signs of aging, you can say it is a treatment as well. So I am going to demonstrate today. My system is Endymed Pure. I don't know whether you guys can see it. So it's got a couple of hand pieces, and this hand piece that I'm going to show you, this is known as IFine, hand piece. Now, if you can see, there are only 4 electrodes visible here. So it has been designed in this way so that you do not have any side effects, and the heat doesn't cause not even a pain, to forget about anything like a vesiculation or a blister. So it's been kept like that. So what happens through these electrodes, that when the current flows, the current is converted into heat, which is transmitted to the skin through these electrodes. And this is bipolar in nature. Of course, I'm getting a little bit into detail. Monopolar RFs are where you have just single pole and we give a grounding pad to the patient. This is bipolar, and as you can see, so we are going to rotate it around in the bony part of your eye. We never put it on the eyeball, and it is going to deliver radio frequency. Now the best part of using an EndyMed system when I talk of bipolar is that they have got 6 bipoles. I mean, there are 6 poles which are going to emit RF. So it's known as a 3D technology. So it's not going to produce anything on the upper layers of the skin, and it's going to work on that collagen network that we were talking about. Now, is there any contraindication for this treatment? Yes, we do say if you have a pacemaker or a metal implant, you may not. But apart from that, anybody who wants to prevent aging or tries to nip the evil in the bud can go for it. So we're going to use gel. As you can see, there is a beep. This is a sensor which my esthetician, I'm going to introduce you to her. She's going to press when she's doing the treatment, and it has an auto sensor in it. So when the skin is not in contact, it stops. And as soon as there are various cycles. So let me just show you. We're going to. So there are various 30-second cycles that we go through, and you can see that we're going to start with periorbital. So each cycle is being around 3 watt. If the temperature, we generally want a temperature of a particular degree. If it's not achieved, we can increase the dose, we can decrease the dose, and each cycle is 30 seconds. So let us see now. Please start. So my therapist is going to do it under my supervision, of course. So here is my patient. Now my patient is a diabetic patient, and she is not very keen to do something invasive, and so let us show how we're going to do. So Suma, my therapist, is going to do this procedure for me. I hope you can see this. We just stay on the bony part, we don't go near the eyeball. One second, I don't know whether I'm able to show it better now. Yes, please do. You continue to do. So you can see she lost the contact, so the machine stopped beeping. There is a LED sensor. So one cycle is done. Thermometer. Continue to do. So patient doesn't, you may feel a little warmth when she's doing the procedure. Yes, you continue to do, don't bother. Correct? I think now you can see it better. So we'll be checking the temperature. Good, it's not overheated. And if the maximum temperature is not achieved, we may even increase the cycles. So she makes sure, my therapist makes sure that you're not on a single area for a very long period of time for uniform distribution of heat. Pulse interrupted, bad contact, please be careful. You can see the patient is quite comfortable, there is no pain. You can't even see a slight redness. So this takes care of a little bit. RF would also work on the, I can't say it can be a treatment for your under eye bags, of course, but because you're remodeling the skin around, and you are also, this also prevents the hood tightening. You would see a lot of patients whose upper eyelid is tightening. So we're starting with new cycles, the 30-second cycles, and we will cover your area. As you can see, we are not going near the eyeball. Focus on contact, please. If you lose contact, the machine is going to auto stop it. So we're going to now do the infraorbital region. Can you give me a tissue, please? Please continue soon. Clean the inside of the eye. We make sure we don't go near the eyebrow and we go near the... So this is going to prevent the hood tightening. Just 1 second, need to clean the inner side of the eye. So the moment she stops contact, the machine stops. Please clean it. Amma, you're comfortable, Idya? Correct? So we keep on adding the cooling gel. Now this also decreases the impedance. The impedance is resistance to radio frequency. It's a heat energy after all. So it increases the conductivity and it also makes sure patient's skin is a little cool, improves the contact of machine because we have bony orbit. So the machine has got a unique auto sensor thing. Back contact, be careful. Focus on procedure. Please keep on checking the temperature. Is it normal or high? Normal. That means if the temperature is not 37, we need to do it more because there is a typical heat at which the collagen remodeling works best. What has happened, I would say my patient is a little older age group, and for this age group, of course, a non-invasive treatment cannot match the injectables and the fillers. But as you can see, please clean the eye of the patient. So as you can see, we have finished. So there was this one session, few seconds left. Now we are going to use the same treatment. Is it okay?
Yes.
So can we see the changes, Soma? What changes do you feel? Would you like to explain? Clean the eye of the patient, please, my patients. Yes. Amma, comfortable idea? Very good, very nice. Chanagide? Bise feel agutte? Illa. So I was just trying to ask her if she's comfortable. So let us compare this and this. Do you see a slight lift? That is, this is due to immediate contraction of collagen. So if we compare these two areas, for a treatment which is non-invasive, my patient is very comfortable. You can see the result, a little lift. If we compare the eye, which we haven't done, open your eyes, Amma. Give a tissue to man, please. New one. Yes. Open eyes, open ಮಾಡಬೇಕು ಕಣ್ಣು. Yes. Are you able to see both the eyes?
Yes.
Can you see the difference? Smile ಮಾಡಿ. Just the big smile. Very nice. Can you see the difference? So more important is the happiness. So I'm going to use the same handpiece. Please clean the tip. We're going to use a mask thingy. Once we'll do it. Wait. So we are going to use, I can touch you, right? So we're going to use for this area, smile ma. Yeah. So she doesn't have much prominence. So this is the right time. I mean, we can always try a non-invasive. Gel Cody, please. So I personally use this for, as we age, our lips tend to get thinner and, they seem to recede. So it's because this area, especially as we said, there is a fat descent. You can start. So with radio frequency, we try to not only stimulate your collagen, it also increases fibroblast activity. So you will actually develop new collagen. And as you can see, my patient is quite comfortable, and we're using the same IFine handpiece for the marionette lines. You can see patient is comfortable. She will feel let's check the temperature. Collagen degeneration, collagen increase starts at 45 degrees Celsius and above. So the best results achieved, we are able to, the collagen temperature increases. So the beauty of this treatment is, again I talked about, but the thing is you have to do it once a week for 6 weeks and then starts the maintenance sessions. So it's long lasting, but it requires a couple of sessions, right? We can see, we will be able to see some changes when the patient, so as we age there is a downturning of the, if you can see, call them smile lines. So the best time is to start early, because beyond a point of time we would have to take help of other modalities, right? So, and it is also safe for all skin types. Please clean patient. So we demonstrated IFine for the periovital area. We also demonstrated it for the jawlines, right? And we will be also now talking about our second handpiece. Can you've done two cycles?
Yeah.
Can we show ma? Okay. Parvagilla. That's just gel. Yeah. Smile ma. Is it coming okay? Yes. Just smile. So, though I think we should have done the full area, but there is always a slight lift. Now, I'm going to demonstrate. Can you see that? So, we use the same thing for the jawlines as well. So, I'm going to now talk about the second handpiece, which is known as Pro Shaper. Now, Pro Shaper is as you can see, the handpiece is slightly big. That's also because we use it for areas like jawline. We also use it for the the tightening of skin in the upper arm area or around the knee when there is a sagging. So I'm going to demonstrate. Please change the handpiece. So I'm going to demonstrate the Pro Shaper for a tightening of skin. I can't say, of course, it can replace anything which is like a thread or, we normally would tighten, for masseters, we would give a botulinum toxin. But today my focus is on non-invasive. So we are going to use the same radio frequency energy. If you can see, it's shaped like this because the tree deep radio frequency is able to do uniform volumetric heating, which is essential for collagen remodeling. So, can we start?
And this can do it.
Yeah, we'll change the cameras. Yeah. Yes. You can see. Let's focus on the patient. Yeah. This is right. Turn this side. So please go ahead. Again, the same thing, and we have chosen the mini shaper. So EndyMed also has got 2 more hand pieces. There is a treatment known as EndyBlef, where we do this IFine, and I will show you. There's another hand piece known as FSR hand piece. So FSR is resurfacing. So we do IFine and we do resurfacing for this area. So it helps especially in rejuvenating this area, and all those dark circles and the hollow sunken eyes which are resistant, and you've tried many creams and you've tried many chemical peels and you don't find, we may opt for EndyBlef. It's popularly known as EndyBlef. So it's a combination of IFine, what we did, with 1 or 2 sessions of fractional skin resurfacing. Again, it's a different hand piece using the same radio frequency system. So yeah. So we'll continue to talk. I'll show you. We'll focus on the patient. Yes. So what the patient actually feels like is a hot stone massage. Right? You can see there was no redness, there was no swelling, there was nothing. What is it? So no time, the temperature, we allow it to be more than 37, and if it is not 37, we continue to do it until the correct temperature is achieved. So patient is going to feel a little warmth in this area. Yes. So we're done. 3 cycles done. So normally check the temperature. So we check the temperature. Show me the temperature. Yes. Good. Should I go? I think we need 1 more cycle. So we didn't achieve 37 degrees Celsius. So I'm going to give her 1 more cycle. So this is especially good if you want to keep your jawline taut, and possibly also to prevent further aging, further sagging of skin to some extent, right? No treatment when it comes to anti-aging is perfect. We need to combine, we need to permutate the treatments. As I said, in certain patients they would require. So especially in certain patients there is, sometimes there are fat pads. So nothing, this is not going to work there. So can you show FSR hand please? Right. So very important for us to know the, I think I need to unlock this. So we use the mini shaper, the IFine, and I'll also show you that FSR that we use for, and then I have this EndyMed Intensive, and that is like the big dog. I mean, that's microneedling RF, and we use it for acne scars, we use it for stretch marks, we use it for, so I'm talking about this hand piece, little bag. So I need the, I need the tip. So we use a disposable tip for the patient, and you can see the bipolar electrodes, right? So we put a disposable tip on top of it. Open it. So in all of them we are using, so I don't know if you have questions, if you have any questions. No, I feel, see, aging is going to require a lot of combination. So you need a good diet. Of course, if somebody is a diabetic or a pre-diabetic, aging is going to be accelerated. The daily skincare routine, the most important thing is application of sunscreen. You need to start a retinol early, and especially when you see the fine lines. But understand that the creams are not going to penetrate beyond the upper layer. So dermal collagen remodeling would require some sort of, intervention. So I use this now. So you can see this is the FSR. So with this we are able to now not only we stamp it very gently on your skin, and through these pins radio frequency would go. So I am able to appreciate the tiny holes in it. Through that your dead skin would come out. So after I do the procedure, those stamps will be visible for the next 3-4 days, and almost in a week's time you will have your new skin back. This I use for acne scars, I use for anti-blef in combination with IFine. We also use it for improving the texture. So many a times I have patients who have no issues except prominent open pores, early wrinkling, and they feel that their skin has become dull. So I would love to do this. I mean, it adds years to your skin, right? Of course, I insist on a good diet, and I insist on a good lifestyle, and I insist on the daily good practices. But if you are noticing those early signs, those early wrinkles, you're noticing those early, hollowness under the eyes, or you feel your face is drooping down, or you see those early smile lines, it's probably the right time to start something. And non-invasive is my favorite, because the only thing is you have to come once a week and for around 6 weeks, and thereafter you can always continue to have a maintenance session or so. But personally, it's my favorite. So I would like to show the intensive needle. Can you show me an intensive micro needle? Yeah. So there is a separate handpiece where we use these gold plated non-insulated micro needles. So micro needles will penetrate, and we use this in various things. Let's focus here. So we use it as, this is the FSR handpiece, and we use this in the intensive mode. So we attach a tip. We have it for various areas. You can use it for forehead, orbital, my favorite, and of course we use for stretch marks as well. And through these needles we are able to penetrate into the second layer of skin. So the needles go to the second layer. They if I add a needle, I haven't added the handpiece. So depending on the treatment depth that we can decide from here, right, it can go up to 3.5 mm. So we go to the depth that we require, we deliver radio frequency, and we come out. So there is nothing visible, there is minimal downtime. Slight pain would be there, but this is the big dog. This is like, out of them, the one that probably is the most satisfying. So we can say invasive to the least degrees. So friends, today we saw a live demonstration of the radio frequency treatment for the eye periocular rejuvenation, for the smile lines, and we also saw a bit. Would you like to see the patient once? Though it's very difficult for me to
Check here and
just check. Just smile. Amma, smile, Mari. Smile. Big smile.
పెద్దగా ఇంకా గట్టిగా.
Do you see a difference? Right. I do. So, if you have any questions, and I think Amar is asking me, is it painful? Not at all. Sittings we generally require once a week for 6 weeks, and improvement in diet is very important, Jyoti, but you can't say it's going to do the magic. We know that we need to work at all the 3 layers, and it's a painless treatment, non-invasive treatment, and me and my team is always there to answer your questions, your concerns. If you have any comments, please let us know. If you have any questions or you want any more information, don't forget to write something in the comment section below. And I think we'll be keeping it on our IGTV for the viewers who joined in late. And have a good day, and make sure that you never forget that a good skin, or to prevent aging, we need good sleep, we need good sunscreen, we need a good skin routine. So don't forget the 3S that we talked about. This all works as an adjunctive in supplementary treatment. Friends, I'll be logging out and see you soon in another live session. We'll be seeing what next and what better can we achieve with sometimes very good non-invasive and painless modalities. Bye bye. Have a good day.